Hello, viewers. Good day. Thank you for tuning in today's Pocket webinar. I'm Paul Anisco, your host at defendcov.org, where we help you cope up with COVID 19. Our guest speaker is an ENT doctor. He's a fellow of the Philippine Society of Otolaryngology, Head and Neck Surgery. He graduated residency training at Quezon City General Hospital in 2010 and is currently practicing as an active consultant at St. Anthony College Hospital in Rojas City. Please welcome our guest speaker today, Dr. John Paul Anisco. Hi Doc, maayong adlaw.
Mayong adlaw.
Kumusta naman dyan sa Rojas, Doc?
We're doing fine. Medyo dumadami cases but at least konti lang ang mortality natin.
Oh, that's good to hear, Doc. Doc, we just have a few questions to help our viewers understand how to protect themselves from COVID-19.
Doc, our first question is, how does COVID-19 infect our body?
Well, the mode of transmission of COVID-19 is through yung tinatawag natin na droplet. It comes from the secretions. If an infected person, let's say, even just breathes, coughs or sneezes in front of another person, so it enters your respiratory tract, meaning your nose and your throat, even the mucous membrane of your eyes, you can get infected with COVID-19.
Second question, how does a face mask protect us from COVID-19?
We wear face masks not just to protect ourselves, but as we all know, more than 90% of COVID-19 patients are asymptomatic or have mild symptoms. So the main purpose of the face mask is actually more of to protect uh, the other persons in front of you if in case you are a carrier or you have mild symptoms or you are infected with COVID-19. So it's more of to protect the person surrounding you rather than protecting yourselves.
Doc, just a follow up to that question. Do you mean that when we use a face mask, we don't just protect ourselves, we also protect other people?
Yes, it's dual purpose and it's actually more of protecting others. As we all know, you can easily cough or sneeze, and the droplet can get to anyone. So if you have a barrier, if you have a mask that can catch those secretions, then the chances of you infecting others, even if you are asymptomatic, is low.
Okay, what is the best mask then to use for everyday protection?
The best face mask for everyday purpose, we can use as a surgical mask. I have an example here. Uh, we have the blue side and the white side, which is the absorbent side. So this is the one that is attached to your face. So it can easily absorb the secretions in case you are a carrier. This is what I have here is a surgical mask. I'll just fix the camera. So you have the blue side and the white side, which is the absorbent side. So as much as possible, we avoid touching the both sides of the mask. So we just
Okay.
hold on to the strings. Um, there is a bendable side here in the top. So this fits to your nose. You press it like that. Then both loops like this, and you pull this side down. So if you want to remove your mask, you just hold it by the strings like that, and always wash your hands and do not touch each surface of the mask.
If I don't have money for a face mask, can I use a handkerchief or any cloth to cover my face?
Well, you can use the homemade cloth mask as long as the material you use is not very thin, it's not very porous, and you can use multiple layers, so it could add more protection. So
Okay.
if in case you have the secretions, it can trap more all of the secretions that you have.
If I have difficulty breathing with a face mask, what alternative can I use?
There is no alternative, and you will not have difficulty breathing wearing a mask. So masks are fairly comfortable. You just have to get used to it. If you don't want to wear a mask, then you do not go outside. It's as simple as that.
Doc, the government has mandated the use of face shield together with a face mask. Why is a face shield necessary when you're already wearing a face mask? What's the science behind this?
As I said earlier, the face mask is not perfect. So the secretions or the air that you breathe out can still uh, it's not completely trapped by the mask. So an additional barrier, which is a face shield, which doesn't have pores, is a perfect addition to the face mask. It further lessens the chances of you or the other person getting infected.
Doc, our last question. As an ENT doctor, what is your advice to your patients to protect themselves from COVID 19?
Well, that's really our specialty, no? The airway and the respiratory in the head and neck. So obviously, we examine the patients with in their nose and the mouth. So uh, we use barriers, and if we examine the patient, and my advice to them is really just wear the mask and face shield if you're outside, and if there's no need to go outside, just stay at home.
Doc John, thank you so much for answering all our questions and for your time and effort to make this pocket webinar very meaningful. I hope we can do this again soon. Stay safe.
Thank you for having me. Thank you. Stay safe.
I hope we're able to elucidate you on the use of face mask and face shields. If you like this video, please press the like button or subscribe to our channel. Again, stay safe, stay healthy, and visit us at defendcov.org. Have a nice day.